We're examining melanoma, what it is, what it does, and giving you the facts to know your body. Melanoma is not the most common type of skin cancer, but it is the most serious. It develops from cells called melanocytes, which make the pigment that gives skin its color. They can also form moles, which are non-cancerous growths on the skin. When there's unrepaired DNA damage to a melanocyte cell, mutations are triggered that turn the cell abnormal and cause it to multiply rapidly, forming cancerous tumors. So what causes this DNA damage? Ultraviolet light exposure accounts for approximately 95% of melanoma cases. Natural UV light from the sun and artificial UV light from tanning beds are equally capable of causing melanoma. Genetics and immune system weakness are other possible contributing factors. From 1982 to 2011, rates of melanoma in the US doubled, and the American Cancer Society estimates there will be over 90,000 new cases in 2018 alone. Anyone can develop melanoma, regardless of skin color, but it's most common in Caucasians with fair skin. Having a lot of moles puts you at higher risk, and family history can also play a part. The older you are, the greater the risk, with 63 being the average age most people are diagnosed. Melanoma can appear anywhere in the body, even in areas that aren't exposed to UV light. But it's most commonly found on the chest and back, legs, neck, and face. It's very treatable when found early, but if it spreads, the chances of survival drop dramatically. For people of color, diagnosing tends to happen in the later stages of melanoma, which is why research shows these patients have lower survival rates than Caucasian patients. In other words, early detection is key to saving lives. Let's talk with our expert, Dr. Jabber, about detection, treatment, and prevention. Dr. Jabber, I know early detection is crucial, so what are some things we should look out for?
If you notice a mole that's new or changing, there's something to look out for. The other thing to look out for is if a mole's different than other moles on your body. That's the ugly duckling. The ABCDE guide is a great guide to help you evaluate your moles. A stands for asymmetry. So if you cut a mole in half, it should be even on both sides. B is border. You don't want moles that have jagged edges. C is color. You want moles that are even in color. You don't want moles that are black, white, blue, or pink. D is diameter. You want moles that are smaller than a pencil eraser in size. But the most important is E, or evolving. If you have a mole that's changing, itching, burning, or bleeding, you should have it evaluated by a Board Certified Dermatologist. If they're concerned about the mole, they'll do a biopsy where they remove the mole and they send it out for testing.
If someone is diagnosed with melanoma, what are their treatment options?
If it's caught early, a simple surgery is all you need to do. Unfortunately, if melanoma is caught later, then you may have to do, in addition to surgery, chemotherapy or immunotherapy as well.
Nobody wants melanoma, so what are your top tips for prevention?
You want to practice sun-safe behavior. So you want to find shade, bring a hat, sunglasses, SPF 30 or higher sunscreen. If you want to be tan, get a spray tan. So the key is to be smart about your sun exposure.
Dr. Jabber, those are great tips. Thank you so much for joining us today, and now you know your body.